Hey everyone, I'm Mike Jones and I'm back here to tell you more about our Advanced Medical Exercise Specialist Manual. Now, this manual is the advanced guide for medical exercise professionals, medical fitness professionals, post-rehab specialists, um, corrective exercise specialists. If you're a personal trainer, you're working with a medically based client, you want to get this manual. Now, we have two versions of this. This is the hard copy version. It is 1,228 pages. And folks, this thing is pretty heavy. We also have a digital version available that you can pay for and it'll download immediately and you can start using it immediately on your cell phone or on your laptop or even on your iPad. You could take it every place that you see clients, and folks, it is amazing. It has multimedia clips so you can actually click information that's in the manual. It'll take you out to our professional resources website where it will show videos and it'll give you lots of different things that you can use to manage your clients, build a practice, and connect with medical professionals. Now, with that, there are 30 sections, and what I'm going to do is go over 10 of those sections to give you a better understanding of what's in the AMES manual. I think you'll find this manual is the ultimate guide for medical exercise training. It's based on the 30 years and what we've learned over the last 30 years teaching medical exercise professionals around the world in our medical exercise specialist training series. So if you don't mind, sit back, relax, learn a little bit more about the AMES manual, and I guarantee you folks, this is something that you can use to build your practice, manage your clients, and connect with the medical community. Take a look.
Hello, I'm Dr. Michael Jones, president of the Medical Exercise Training Institute, and thank you for taking the time to learn more about the contents of our Advanced Medical Exercise Specialist Training Guide and Protocols, or what we affectionately call our AMES manual. Now, this manual is based on 30 years of teaching medical exercise professionals around the world. We have two versions of this manual. We have a hard print copy that you can order. We will ship to you via the United States Postal Service, and we also have a digital copy of what we call our AMES e-manual. If you would, we're going to use this AMES e-manual for our demonstration today to give you an idea of the content of the AMES manual. Now, again, we have a hard copy version, 1,228 pages, is shipped to you via the United States Postal Service. And then we also have the digital copy, or our AMES e-manual, that you can actually order online. It downloads, and with both of these, you have access to our AMES professional resources. This is a series of video trainings and video demonstrations that review assessment guidelines such as manual muscle testing, some special testing procedures, as well as goniometry and other things. So please, if you would, sit back, relax. We're going to take a few moments and talk about the contents of our AMES manual. Now, if you would please, you'll see we've downloaded this to Adobe Acrobat Reader. Please make sure you have Adobe Acrobat Reader on your computer before you order the AMES e-manual. You'll notice here we have a number of tabs along the side. So I'm going to open up the tabs section here. And what we've done in the AMES e-manual, we put tabs in along the way so you can navigate the manual much easier. You'll notice here with our table of contents, our table of contents is pretty extensive. When we look at the subjects that we actually talk about, you can see we go from scope of practice to goniometry and procedures and guidelines to gait analysis to MES checklist, and also into HIPAA guidelines. So these are all part of the AMES manual, and you'll get access to these contents when you order the hard copy or the digital copy. Now, let's go over some of the important components of the manual. We talk about the scope of practice and the role of the medical exercise specialist. And in this section, we go extensively into that. You notice we give you diagrams as well as written information. So we talk about the role of the medical exercise specialist in the healthcare system. And we do that from the standpoint of how you'll interact with physicians, physical therapists, chiropractors, and as you, the medical exercise professional. We also look at the scope of practice for the medical exercise professional and outline this in detail with the diagram here, as well as with written information. We have another section where we look at the 6-point client management system. Now, this client management system is essential. When we train physicians or nurses or physical therapists or chiropractors or any healthcare providers, we give them a specific step-by-step process that they use in evaluating and treating their patients. We need the same thing for medical exercise professionals in evaluating and training their clients. So this 6-point client management system goes extensively into the components or the 6 points that you need to understand and always keep in mind as a medical exercise professional managing your clients. We go extensively into the 6 component areas in the text, and we even go into some of the various testing procedures that you'll run into along the way that medical professionals are utilizing in managing their patients. We also have a section where we look at medical history, vital signs, and red flags. Now, this section is very important because as you're working with a more complicated client, it's essential that you understand why and how to conduct a medical history, gather vital signs, and look for red flags. So in this section, we actually have information where we look at medical history questions. You can see we have a number that are outlined here. And these medical history questions go into more depth than you'll get with a PAR-Q. And we teach you how to ask these questions, what you're looking for, as well as how to apply the information in developing the exercise program. We also talk about vital signs. These are vitally important, of course, and we talk about what vital signs ranges are, as well as we go into extensive procedures here with regard to how to actually take vital signs. Then we also look at red flags. We look at universal red flags that the medical professional looks at. And also we look at red flags that the medical exercise professional looks at. And you need to look at these red flags and think about them with every training session, as well as with your assessment and reassessment. As we move farther into the remainder of this decade and into the next decade, medical exercise training will become an essential component of healthcare management and medical management of many clients with medical conditions. We must be able to measure our outcomes, and we have a section here on functional outcome measures. These functional outcome measures are vitally important because it allows us to now say objectively if the client is getting better as a result of the exercise program. Now, with that, we have to understand the components of function. So we have a section here where we talk about the components of function. All the components of function, you can see our outline here using our function wheel. Then after that section, we go into the functional outcome measures. We've identified 14 functional outcome measures, and we look at those in the text and give you specific examples of each one and detailed understanding of each one. We also look at functional assessment scales. Now, this is something that we've included in our medical exercise specialist training series since we started back in 1994. These assessment scales allow you to, in a very simple and easy manner, assess the client's functional capability. Because for medical exercise training, that is essentially what we do. We help the client improve their level of function after rehab services are done, such as physical therapy, occupational therapy, and chiropractic care. We help the client improve their level of function utilizing exercise. So in this section, we go into what functional assessment scales are. You'll notice here we've outlined the functional assessment scales. And these functional assessment scales look at each region of the body as well as looking at gait and balance. So we look at each one of those in detail, and you'll see here we have forms that we use. For instance, this is our oswestry form. Once you actually order your manual, you also may order your own set of forms to go along with them. We have an essential MET forms kit that you may also order. So each one of the functional assessment scales, we have a form for, and we actually explain the forms in the text. So we have the functional status index. List-Holmes scale is noted here. You also will see this is the Harris hip scale. Our lumbar oswestry scale is shown here. The shoulder strength scale and the Zanetti gait and balance scale. Now, again, when we start looking at the idea of managing function, we must have a means of getting an idea of the client's functional capability. And we explain that these functional assessment scales should be done periodically every 30 days. They give you an actual numeric value that you can now use and report to the doctor, therapist, chiropractor, or in some instances, even to the insurance carrier. Our next section here is manual muscle testing. Now, in our AMES manual, we'll look at manual muscle testing as well as goniometry and some special testing procedures. Now, we realize for fitness professionals, looking at a specific muscle and its weakness And we all understand that muscles work in combination together when performing functional activities. But there may be a time as a medical exercise professional, you may have to identify the weak muscle in the muscular functional chain. So what we've done here, we've gone and we give you muscle testing guidelines as well as the muscle testing grading procedure, both the functional muscle strength scale or the FAST scale, as well as the traditional muscle strength scale. So now you can communicate what you find with your strength testing, you can communicate that to the doctor, therapist, and chiropractor. And what we've done here, we've looked at individual muscles. So let's look at the deltoid here. And we give you the procedure for testing the deltoid, how to position the client, how to apply the resistance. And you'll notice here at the bottom, it says click image to watch video demonstration. What clicking the video does, it will take you to our AMES professional resources, and there we'll have a video that you can actually watch. Now, with the video, we may have a little bit of audio. With the video, we'll show you how to take the client through the procedure, how to apply the resistance, and with the strength testing scales that we gave you, that now allows you to look at this client and to determine their strength level. We also have testing procedures for all the muscles in the upper extremity, as well as the lower extremity. Now, we do the same thing for goniometry. We have an introduction where we look at goniometry, and then we go into upper extremity testing. We look at shoulder flexion, for example. We give you the step-by-step procedures as well as what the ideal value should be. And if you click the image again, it will take you to a section where we're looking at goniometry of the shoulder. We use the goniometer. We'll show you how to set up the goniometer. And this section gives you step-by-step procedures as well as playing the video itself. So we show you how to position the goniometer, how to hold it, move the client through the range of motion, reposition the goniometer, then actually how to read the goniometric measurement. Now, this will become more important as you work with more medically based clients and also as you start to communicate with insurance carriers. And folks, I know everyone says, I'd rather not deal with insurance carriers, but eventually at some point you will have to deal with the insurance carriers. So that's our muscle testing area as well as our goniometry area. We have also an area where we look at some special testing procedures. An example of a special testing procedure may be speeds test, where you need to determine if the client is appropriate for exercise, not to determine a diagnosis. Now, we have special testing procedures for the spine, the knee, the ankle, the hip, as you can see here along the side, the elbow, and also for the shoulder. Again, we establish these bookmarks in the AMES e-manual to make it easier to navigate through the information. The hard copy of the manual does have a table of contents, which will allow you to navigate the contents easy. We also have a section on documentation and communication, which will become more important over the next decade. We go into what is documentation and communication. We also talk about what is a medical or medical exercise training record. We also go into some of the components of documentation. And we walk you step by step through documentation guidelines. And then we also show you some of the various forms that you'll use in medical exercise training, such as a referral form. With each of the images, we have content and written dialogue that gives you step-by-step procedures and a greater understanding. We also show you the training session log, as well as written information on the progress report and a copy of a progress report. We also go into some aspects of medical exercise training communication, this communication being between yourself and the medical providers, physicians, physical therapists, and chiropractors. And then we have an overview of the medical exercise training documentation and communication system, which is vitally important for every medical exercise professional to read. And it goes step by step through all the procedures and all the phases of communicating with the doctor, therapist, chiropractor. And we also go step by step into each one of the MET forms. So you have a pretty good understanding and a detailed understanding of how to communicate with the medical community. And then finally, we have a documentation and communication flowchart system. Now, let me move our bookmarks here so you can get a better understanding of this. Now, it looks like hieroglyphics, but we take you step by step through this system in the manual itself so you have a better understanding of how it works. And as we continue to move on, we have a section on gait analysis. This gait analysis section talks about the components of gait in great detail, the 5 phases of gait, as well as we look at some of the deviations that you may see in gait, such as deviations at the hip, the knee, the ankle, foot, and then we also take you step by step through the gait analysis process. We have a section on MET assessment and management guidelines. And what we've done here is we looked at the MET training phases, phase 1 training with details as to what you'll see with this client, what the goals are, phase 2 MET training, phase 3 MET training, and then phase 4. And along with that, we provide you with assessment checklists for a multitude of medical conditions. It's not uncommon to work with a medically based client that's been referred to you. You want to assess the client and you need an assessment checklist. So what we've done here is we've provided an assessment checklist. This is the general MET assessment checklist. And notice what we've done here. We looked at the assessment checklist and we provide step-by-step procedures and checkoffs so you can make sure that you cover all aspects of what's necessary to assess the client. So we've done that for the shoulder, as well as giving you the assessment form. We've done that for the ankle, as well as the assessment form. We do this for all the major regions of the body. We also have assessment and management guidelines where we go beyond just simply the checklist into various medical conditions, and we walk you straight through, and this is the Achilles tendon, we walk you through components of the assessment process where we look at the medical management, we look at the criteria, and the criteria being, is this client appropriate for exercise, the goals and objectives of the exercise program, any precautions, as well as functional outcome measures and client management task. We also have a section on MET management and assessment guidelines. So we look at each individual condition. So for instance, with the Achilles tendon rupture, we now go into more detail with regard to the condition itself. You see, we have several paragraphs of information. We talk about the medical management, what the physician, the therapist, the chiropractor will be doing. But we also look at the idea of the criteria, what criteria the client has to meet to begin medical exercise training, because some clients may still need medical services. We look at objectives and goals, precautions, functional outcome measures, as well as MET client management tasks that should be done on an ongoing basis or a periodic basis, and we give you those timetables, as well as specific assessment procedures, progress guidelines, which are in the form of a flow chart. We'll show you in just a second, and then everything that needs to be documented on this client. And each section concludes, or each condition section concludes with a flow chart. And we do this, as you can see here, for a number of different conditions. And then that takes us into our MET and post-rehab protocols. Now, these protocols were originally designed back in the 1990s. We've upgraded them. And you can see here the protocols. Let's look at the Achilles tendon rupture. The protocols go into more depth and more detail. So with the protocol, we still look at the anatomy, physiology, and pathology of the condition. We look at the medical management. We look at the criteria. We look at goals, precautions, and a sample exercise or fitness program. But then we go into the various phases. So we look at phase 1, and we give you exercises. You're not these exercises are not required for you to do, but the exercises essentially note target muscle groups. So we have the exercises noted in phases. You can certainly use other exercises, but this just gives you a general guideline. A protocol, please remember, is not etched in stone. It's a roadmap. It's just simply giving you a direction. So we have phase 2 exercises, phase 3 exercises, some instances phase 4, and each one of the protocols concludes with a flow chart that you can use as a reference as you work with the client. It again lists everything that we've talked about in the protocol in a one-page document. After our protocols, we then move into our MET professional ethics. And our professional ethics, we put this in a couple of years ago because we're now dealing as medical exercise professionals with doctors, therapists, chiropractors, clients, insurance carriers. So we have to be very careful about ethical guidelines and procedures. So we've identified 30 medical exercise professional ethical principles, and we've written each one of the principles out here in this section. We go into great detail with them. And then we also have a presentation. So we present each individual principle here. And you can see we have the 30 principles. I'll just look at principle number 12. Okay. Then we have principle number 23. So we have 30 principles. And we just go step by step through each one of the principles. And then finally, we have a section where we look at, and you can see we have a number of sections here, but we're going to look finally at our medical exercise practice management system section. This is a series of systems that are essential for every medical exercise practice or facility or business to have. And with each one of these, we go into detail. So for instance, we look at the 10 client management systems. There are 10 of them that we've identified. And these client management systems include operations, documentation, communication, medical relations, marketing, billing, scheduling, staffing, assessment. And with those, we break each one of them down even more so. So we have a section on each one that goes into detail. So these are the components that help you build a strong practice. And with each of these components, this is looking at the client management system. We also give you detailed written information, but we give you a flow chart for each one. So for instance, this is the client management system flow chart. It looks like hieroglyphics right now, but after you read the section, then you'll see how important these flow charts are for managing your practice as well as producing better outcomes and making your practice more profitable. So we have an assessment system flow chart. We have an operation systems flow chart. We have a documentation systems flow chart, a communication system flow chart, a medical relations flow chart, marketing flow chart, staffing flow chart, which I know many of you need because you're adding additional staff members. We also look at scheduling and billing. We give you step-by-step insurance reimbursement procedures. We give you a scheduling and billing system, and then reimbursement procedures if you're dealing with an insurance carrier. And finally, we give you HIPAA guidelines. Now, everyone understands as non-licensed medical professionals, the medical exercise professional is not bound by HIPAA, but because you're communicating with the doctor, therapist, or chiropractor, they have HIPAA requirements, which means you must in turn meet those HIPAA requirements. So we go into detail with regard to the various aspects of HIPAA and its application as a medical exercise professional. We give you specifics along the way, as well as definitions to consider along the way, and then implementing HIPAA guidelines in your practice manual. Thank you for watching. If you have any questions, please email me at drmike@postrehab.com, or please don't hesitate to go down below, order your copy of the AMES manual. The hard copies are available now, as well as the e-manual copy, which is available for digital download immediately.